What's value? Come on, you've been all day. You've been here learning about value-based payment. So WTF, what the fun, is value. What's value?
Better healthcare outcomes.
Better outcomes. Bring it on. How about more?
Efficiency.
Cost savings. I heard efficiency. Some of the peanut gallery over here. Access.
Less didactic presentation.
Jokers from the back row. Collaboration, coordination. Love it. So how do you get there from here? And those who've seen me do some of these things before know I like to draw the circle of the 4 A's. None of those things is possible if we don't know things about what we're doing. So the first step of the process of these 4 A's, I bring it all back to IT ultimately, I guess, is we acquire information. So if you imagine the 4 quadrants in my slide deck here, the 4 quadrants of the circle, the upper left-hand quadrant is acquire. We acquire information. How do we acquire information? We ask questions. We gather data in a medical record. We connect to a health information exchange. We acquire information. If we're a community health worker, we interview patients in the field. We respond to questions when people text us to find out where to go for their, the rusty nail they just stepped on. So any interaction that we have that's part of care provision represents information that can and should be captured. Raise your hand if you've ever used Amazon.com. I'm not looking, because it's PHI. So Amazon has a patent, an anticipatory care. Does anybody know about this patent? It's anticipatory, it's predictive, right? So can we predict which patients with congestive heart failure are going to end up in the emergency department? Can we predict which kid with asthma is going to end up in the emergency department? Well, we've not used our data very well, so the answer is probably, in most cases, no. We can't make those predictions. Can Amazon predict what you're going to buy tomorrow?
Yes.
Fascinating. How do they do that? Data. The data of what you've looked at and the data that people like you have looked at. So they have created a persona for you, and if someone like you looked at something, that enhances the likelihood that you are going to make a certain action, make a certain purchase. Exactly the same thing could, would, should be done for our kid with asthma or our 74-year-old with congestive heart failure. So if we acquire as much data as possible, we will be in good shape. What do we do next? We aggregate it. Well, what do we have for that? For aggregation. How do we aggregate information in our region? Hint. HIXNY. It's a way of it used to be called HIE, Health Information Exchange. Now we call it a RIO. Before that it was, anybody know? Multiple guess. Professor Allen, what was it called before a HIE or a RIO?
A piece of paper.
No. A CHIN, a Community Health Information Network. It goes way back. So after we aggregate it, what do we do? If we pulled it all together, it's a big hunk of data. What do we do with it now? We analyze it the next day, which means we figure out what means what. And then after we analyze it, now what do? Well, for Amazon, we act. Because if we're Amazon, we put up an ad, or we send you an email and we say, hey, thought you were looking at those moccasins. Your mom sure would like a pair. So we act. And the last day, and this is important. It's important because of the role that the state plays. It's important when we think about value-based payment and how we migrate to value-based payment, especially in organizations that don't have experience with this. The last A, the final A. It's a trick question. accountable? How do we hold ourselves accountable for doing the things that we said we would do? And we talked about it when you all started. What's value? Well, all of those things that represent value. Can we improve outcomes? Can we reduce cost? Can we enhance the lives of the people, I almost said patients, of the people whose lives we have committed to improve? If we can do that, and we can define what success is, and that's hard, by the way. It's hard to define what success is in quantifiable ways. And we call those measures. And now we're back to the other A, about getting data so that we can measure ourselves. So on that note, let's all obey the speed limit on our way home. And thank you so much for coming today.